Tartar formation begins the moment we eat. After every meal, food particles and sugars accumulate on the surface of the teeth and in the spaces between them. If the mouth isn't cleaned properly, naturally occurring bacteria begin feeding on these food remnants and produce a sticky substance called plaque. Plaque is a thin, transparent, sticky film made up of bacteria, saliva, and food debris. If not removed within 24 to 72 hours, it starts to harden due to minerals in the saliva, like calcium and phosphate, and gradually transforms into what we call tartar or calculus. But what exactly is tartar? Tartar is a hard, yellow or brown substance that strongly adheres to the surface of the teeth and gums. It cannot be removed by regular brushing or flossing. It typically accumulates in areas that are harder to clean, such as behind the lower front teeth or around the back molars. What are the harms of tartar? First, tartar provides an ideal environment for harmful bacteria to grow, leading to gum inflammation. It starts with bleeding when brushing, redness, and swelling. If left untreated, this can progress to chronic gingivitis and eventually cause gum recession and loose teeth. Second, tartar interferes with proper oral hygiene. Its presence makes it difficult to reach the tooth surface, paving the way for new cavities to form. It also contributes to bad breath, as bacteria build up in and around the tartar. Third, there's the cosmetic issue. Tartar stains teeth yellow or brown, especially in smokers or people who drink a lot of tea or coffee, making your smile less attractive and affecting self-confidence. How can we prevent tartar buildup? First, brush your teeth twice a day using a soft-bristled toothbrush and fluoride toothpaste. Second, use dental floss daily to clean between your teeth. Third, rinse with an antibacterial mouthwash to reduce plaque formation. Fourth, visit your dentist every 6 months for a professional cleaning using tools like the ultrasonic scaler to remove any tartar. Finally, remember, once tartar has formed, it cannot be removed at home. Prevention and daily oral hygiene are your best defenses for a healthy smile.